When you are going through IVF, you see your specialist, you see your nurse, and you see our office team, but you don't see the laboratory and what happens behind the scenes with your eggs to make those beautiful embryos. Now let's go and have a look. It all starts in the operating theatre where the eggs are collected. The key thing in the theatre is to make sure we always have the eggs in the right condition from the very moment that they are obtained by the doctor. It's critical that the temperature and gas exposure of the eggs is precisely all the way through the process. As you can see here, our scientist is working in a closed environment to protect the health of the eggs from the moment that they are collected. The identity of each patient's eggs are electronically tracked all the way through the laboratory. When the eggs are collected, they go into a tube which has a chip attached. We have the patient's identity on one side and the chip on the other. This connects to our electronic witnessing system, which monitors the identity of the eggs, the sperm and the resulting embryos all the way through the process. Our embryologist has to log into the electronic witnessing system before every procedure. Everything that enters into the scientist's workstation has to match the ID details that have been entered into the witnessing system. If it doesn't match, an alarm will go off. As the embryologist prepares the dish of culture media, she is ready to start receiving the fresh eggs from the nurse. The search for eggs has begun and the embryologist is going through the fluid, hunting very carefully under the microscope for the first egg. As she is examining the fluid, the embryologist counts aloud to let the clinician and nursing team know how many eggs have been collected. The procedure is now complete and the eggs, now being tracked by the electronic system, are gathered from the dish that they were put in as they were collected, and they are transferred into a chipped and labelled tube. For those locations where the laboratory is within the day surgery facility, the embryologist labels the tube with the number of eggs collected and they are put in an incubator to be kept warm. The temperature is set to 37 degrees and the eggs are placed in a secure container to be transported to the laboratory. When the eggs arrive into the laboratory, the first thing we do is plug into the electronic witnessing system to confirm the identity of the eggs. As well as the electronic witnessing system, we have a manual backup and the embryologist will double check the patient details. At every stage in the laboratory, the patient's details are always checked twice before work begins. The workstations in the laboratory have a carefully controlled environment to protect the health of the eggs. The first thing the embryologist will do is confirm the number of eggs to ensure that they are all accounted for. As they remove the eggs from the collection tube into a digitally tagged dish, the embryologist will record how many eggs sit in each well of the dish so as to never lose track of an egg. Now we need to fertilise the eggs with the sperm, but first we have to prepare the sperm sample. The early assessment of the sperm is very important to ensure that we have enough healthy sperm. Eggs can be joined with the sperm by either IVF, where the egg is simply coated with the sperm, or ICSI, where the sperm is directly injected into the egg. To make sure we are using the very best sperm from the semen sample, there are a series of preparation steps that have to be done. We use a special solution that will separate the fast sperm from the slow sperm, called a density gradient, and it's put in the centrifuge. When the sperm comes out of the centrifuge, there are layers. All the debris is at the top, the slow sperm is halfway up, and the fast sperm all go to the bottom of the tube. After the separation process, the sperm is washed and put back into the centrifuge. Then it sits at room temperature to rest the sperm before the insemination of the eggs. In the lab, we will treat some patients' eggs with IVF. This is where the eggs and the sperm are placed together in a dish and allowed to join by themselves. You can see here the egg is in the centre, surrounded by hundreds of thousands of moving sperm. For other patients, particularly those with sperm problems, we may need to directly inject the sperm into the eggs, a process called ICSI. You can see here the embryologist using the micromanipulators to line up the microscopic pipettes to inject the sperm into the eggs. The embryologist will first of all puncture the skin of the egg and then inject the sperm directly into the middle. This process takes a huge amount of training and skill to get right. You can also see from the equipment used that some video gaming skills often don't go amiss. In some cases, men can have damage to their sperm cells that mean that even though the egg is fertilised, the embryo may not grow well. One approach to this is to study how the sperm cells bind to a specific protein that is found in the cells that surround the human egg. In a sperm cell, the genetic material, the DNA, is all situated in the head of the sperm, and that by selecting sperm that bind to this protein allows us to identify the healthiest sperm for injection to the egg. Within the laboratory, all eggs and embryos are cultured in incubators specifically designed for IVF. All our incubators are connected to an uninterrupted power supply and connected to an alarm system that monitors both the carbon dioxide levels and the temperature. You can see the temperature is set at 37 degrees. If it oscillates or go out of range by even 0.2 of a degree, then the alarms go off and the centralised system will alert our embryologists who are on call 24 hours a day to sort out any problems. The embryoscope is a wonderful addition to our laboratories. When an embryo is developing, it is moving and dynamic all the time. With this technology, we can monitor the growth of an embryo every step of the way through because the embryoscope takes a photo every 10 minutes. In this machine, we can see the live images of every embryo and relate it to the exact number of hours that embryo is after insemination. We can also see very clearly that one patient's embryos will grow at different speeds and with varied success. We can watch the evolution of the embryo as the egg fertilizes and the two, male and female pronuclei, appear, then disappear, and the cells start to divide. Firstly into 4 cells, then 8 cells, then hundreds of cells, and of course if a baby is born, eventually trillions of cells. The key to all of this is that for 5 days the embryos are staying in the incubator. We can study them clearly without the need to touch or handle the embryo. The challenge that we face is that we have all of this beautiful information for every embryo developing, but how do we turn that information into a form that we can use to help our patients? What we have developed in partnership with Harrison AI is a highly sophisticated artificial intelligence deep learning system called Ivy, which studies all of these images. It does this without any preconceptions at all and independently looks at each image from the embryoscope to calculate a prediction of which embryo is the most likely to turn into a baby and which one isn't. Here we can see a comparison of embryos that grow well and embryos that develop more poorly. Looking at these images, some of them have the potential for life and unfortunately some of them don't. The key for us is to know which one is the best one to transfer back to the patient. Before we had Ivy, the embryologist selected embryos by eye, and they did a good job of it. But whilst it is obvious to see a poorly developing embryo, it's not so obvious to see the differences between 2 well-developed embryos. How do we know which one is the one to give the best chance of success? What Ivy will do is analyse all the images over the whole 5 days of growth to give us a much more precise guide, more precise than anything we have seen before, as to what is the likelihood that any of these embryos will implant. By using Ivy artificial intelligence, we hope to select the embryo that may give our patients a chance to get pregnant more quickly. In some cases, such as where the couple are at a high risk of having a whole chromosome variation in their embryo, or where either partner is a carrier of a single gene variation that could affect the health of their child, it can be useful to study the genetic makeup of the embryo. To do this, once the embryo has reached the blastocyst stage, a few cells are extracted from the outside of the embryo. These cells are then sent to the genetic laboratory for analysis and the embryos are all frozen. Once the genetic test results come back, we will know which of the embryos is affected by the genetic problem and can then decide which embryo is safe to transfer. We will transfer the best embryo first, but what do we do with the other embryos? We freeze them so that if either the first transfer is unsuccessful or if they want to have another child in the future, they can use them to conceive without having to go through a whole fresh IVF cycle. Nowadays, 1% of Australians born today have come out of a freezer before they were born. So that we can track the embryo securely in storage, the embryologist generates an electronic label with a digital barcode as well as a written label. Every embryo that we have in storage has a unique patient identifier number and a unique embryo identifier and is labelled with the patient's name, date of birth and date of freezing. As well as the female identity, every frozen embryo will record the male partner details so that we have both the egg provider and the sperm provider clearly identifiable. A fixed label with the identity of both partners are attached to the straw that holds the embryo. In freezing an embryo, we have to use specialised solutions to ensure the embryo is frozen safely and in a healthy way. We use a very rapid freezing process that sucks all the fluid out of the embryo called vitrification. It's been the norm for most IVF laboratories for the past 10 years or so. The first step of vitrification is to put the embryo through a series of equilibrium solutions where it sits for 10 to 15 minutes. After it's equilibrated, it goes into the actual vitrification solution where it sits for 30 seconds. From there it goes into liquid nitrogen. It's very important the freeze is done quickly and that solutions used are as gentle to the embryo as possible. Prior to freezing the embryologist will prepare the liquid nitrogen. You can see here there is a cane, which is the big structure that holds the straw with the embryo in it. After the vitrification process is complete, the embryo is transferred into the liquid nitrogen to do the actual freeze. The straw is closed and placed into the cane. The cane is then taken into the storage room. Here in the tank room we store all of our human embryos. In this room alone there are more than 2,000 embryos sitting within these tanks. What the embryologist is about to do is put the cane that holds the straw with the embryo into the storage tank. You can see every position is numbered in the tank, so every position is carefully recorded. We know with precision exactly where every embryo is stored in this room. The liquid nitrogen tanks are at minus 196 degrees, and that's almost as cold as it's possible to get. At that temperature, cells, eggs, sperm and embryos can survive almost forever. What you can see on top of each tank is a monitor. Our embryos don't need any power source to stay frozen, but what they do need is liquid nitrogen in every tank. We have digital monitors on every tank to check the internal temperature of every storage tank, and it is in continuous contact with our security system where we have an embryologist available 24 hours a day. When the time comes that a patient wants to use their frozen embryos, our scientists will warm the frozen embryo. You can see the embryologist here moving the embryo through a gradient of solutions for a few minutes at a time, giving the embryo the right support to allow it to thaw and return to its old shape. Once the thaw is complete, the embryo is ready to transfer to the patient. Now we are ready to transfer the best embryo. Here you can see the embryologist loading the embryo up into the catheter ready for replacement into the uterus. Once the doctor has prepared the patient, the embryo will be transferred into the uterus under ultrasound guidance. Now, after all of that work, our patient faces her anxious 2-week wait for the outcome of the pregnancy test. So there you have it, a snapshot of what happens every day in our laboratories. The combination of expertise and skills of our embryologists, honed over many years of training and practice with the very latest advances in digital technology, allows us to keep your embryos safe and secure all the way through their journey, as well as giving you the best chance of success.